Good morning, everybody. Dr. Shadi Rafich here, Vet Triage. It is June 14th, about 8 a.m. And a little bit late this morning, but it's okay. We'll get through it, and no one's here, so it's all right. So I figured we'd talk about behavioral issues in dogs. It can somewhat be applied to cats, but cats are a bit trickier. And I'm sure I have a few videos actually on the channel regarding this topic, because it's a very common one. And also whenever I contribute my time to the radio station here in town in Las Vegas, shout out to KNPR, state of Nevada. Almost always behavior questions come up from callers. So let's talk about canine behavior issues. There are in the profession board certified behaviorists. There are also phenomenal, and they're veterinarians, of course. There are also some phenomenal local community dog trainers that are not veterinarians, but they know what they're doing. And then, of course, there's always the chance of having a bad trainer, with bad methods and what have you. Just to let you know, there's some options for behavior consultations. They are a bit tough. There is a website, a company that Vet Triage is partnered with called Abadog, Abadog. I think that's right. Let me double check it. And what they do is they have actually an AI generated behavior consultation service. There it is. Yeah. Abadog.com. And so you can go there actually and have a consultation done, a very detailed one by AI. The owner of the company is a board certified veterinary behaviorist, actually out of Australia, and you can do it that way as well. The reason why I'm pushing for that is because it is hard to find a veterinarian in general practice that's good with behavior issues. It's very difficult to find a board certified veterinary behaviorist in general, because they pretty much live like in academia, and there's not a lot of them. And then, dog training with an experienced person may or may not have worked in the past for you. So it's just an option, I would say. But anyway, so if you have a dog that's kind of unruly, there could be, of course, multiple reasons for it. Psychologically speaking, it's tough because dogs are not people. They can't be analyzed in that same way. And they also don't have necessarily the complexity of previous life trauma that may have predisposed them to acting this way to the degree that people do. They're just simpler creatures. But they do have trauma from prior bad experiences. There is still some psychology to it that we can interpret through patterns of behavior. And the behaviorists will try to figure out, okay, what category of behavioral issue is your dog in? As separation anxiety, is it fear, is it aggression, and then from there kind of implement treatment options. So what I'll talk about today, aside what your options are for getting evaluated with your dog, is what are your therapeutic options. And one, of course, is behavior modification. That's the ideal. Behavior modification is more time consuming, it's more expensive, it can work or not, but it is the best, most natural way, let's say, to try and improve your dog's ability to integrate into society, whether it be at home, trying to prevent them from tearing up the furniture whenever you leave the house, or being aggressive towards children or whatever, or whether it be out and about, you're walking your dog and he's dog aggressive or people aggressive or whatever. And so behavior modification is the best way to do this. But of course, it takes the longest and it's the most expensive. It takes a lot of commitment from the pet owner to reinforce the principles that were learned for the dog. So that's one option, and probably the ideal option. The second one would be pharmacological intervention. So medications, things like Prozac do exist in the veterinary field. And in fact, Prozac is one of the drugs, I think fluoxetine. But there are other ones as well. everything from just things that are just sedatives to other behavior modifying agents. But pharmaceutical intervention is a popular one because it's easy, it's quick, it's cheaper. You kind of know right away if it's going to work or not. And but downfall is it's not the most natural way because you're kind of covering up the behavioral issues or sedating your pet or whatever to artificially modify their behavior. But when you're looking at these two options, you have to decide what fits best with your dog's temperament and also what you can fit in terms of finances and time. If you're thinking, if I can't improve this dog's behavior soon, I'm going to have to either relinquish the dog or euthanize him because he's a danger, or I have kids now or whatever, then then times pharmaceutical intervention is the only option you have because you just don't have the time. And if it's a choice between life and death for the dog, then of course I'd push for the less ideal option of medications, because life or death, if you're going to euthanize your dog or this dog's unfit to be in anyone's house, let alone yours, then just throw some drugs at it and see what happens. At the end of the day, some dogs can be improved. Oh, and by the way, the other option is it's a combination of training plus drugs. So you can, of course, combine the two. So some dogs can respond to these measures. Some can't. Some are just dogs that are just unfit to be pets, plain and simple. And if that's the case, then so be it, or your lifestyle just doesn't lend well to a dog that needs that kind of care. So so you have to just accept the fact that some dogs are going to respond and some are just hopeless cases, unfortunately. But that's what we're here to discuss, the tough stuff. So that's my 2 cents on behavioral things in dogs. Obviously, it's a very complex topic, but hopefully I'll give you a basic overview. Now, I said cats were different. Cats are very difficult to train to do anything. Of course, they are trainable. Some are. I mean, I should say most are probably not trainable to any degree, whether it be tricks or whether it be behavior issues. Once cats kind of decide that they are how they're going to be, it's very hard to change them. The same thing when it comes to introducing a new pet to the household. You have a cat, your life is fine. You introduce a dog or another cat or something, and all of a sudden that your previous cat is going haywire, can't handle it, fights and running away and all this stuff. And so it's hard to gradually introduce each other, and it's hard to just wait it out. Cats tend to be pretty stubborn in their ways. Not always, of course. There's always going to be examples that show an exception to these general rules that I'm stating. But in general, cats are very difficult. And so usually if your cat is not, your cat's temperament is not compatible with what you're looking for with a pet, then a pet feline, then it may be time to rehome or shelter, or if it's really bad and just unfit for anybody, then of course euthanasia. But probably behavior, I would recommend a veterinary behaviorist for cats, just if you're going to try and exhaust all of your options, because you never know. Otherwise, it's pharmaceutical intervention with the cat before you give up, if there's no hope here for any kind of compatibility. But drugs will be the way to go with the cats, and see if that helps them. So that's pretty much what I have for today. I encourage anyone to go ahead and post questions or topics you want to hear about, and hopefully we're going to have at least one audience member in the live streams any day now, but we'll keep at it. I'll be back tomorrow, Saturday, June 15th, for another round. And thanks for those who watch the playback. Feel free to donate and subscribe and do all the things, and we'll see you in the next one. Take care.